Welcome to this early session for the ASCP 2024 annual meeting. My name is Greg Davis, and I will be your host for this precursor session, supporting the laboratory workforce through data, certification, and collaboration. This presentation is part of the ASCP's ongoing commitment to try to improve the laboratory workforce and to let all members know what the ASCP is doing to try to improve the laboratory workforce. I myself am the chair of the Commission on Science, Technology, and Policy, and currently the vice president of the American Society for Clinical Pathology. And I'm delighted that we have three speakers today to present to you specific aspects of supporting the workforce as we try to improve our future. Our first speaker is Dr. Susan Harrington. Dr. Harrington is the medical director of the Mycobacteriology Laboratory and also of the Medical Laboratory Sciences program at the Cleveland Clinic. Dr. Harrington serves as medical director of the microbiology lab at the Cleveland Clinic Akron General Hospital. She's a former chair of the ASCP Board of Certification, Board of Governors, and currently she's on the ASCP Board of Directors. And particularly pertinent for this session, she chairs the ASCP Workforce Steering Committee. Thank you, Dr. Harrington, and we look forward to your remarks.
Thank you, Dr. Davis. I really appreciate the opportunity to be here today to present to all of you on behalf of the Workforce Steering Committee. We've made a lot of good progress on many initiatives, so I'm excited to tell you about those today. I have one disclosure that you can see. So to set the framework for my comments, I'll remind everyone about the workforce study that was conducted in 2020 by the ASCP and the University of Washington Center for Healthcare Workforce Studies. The results of that study were used to create a blueprint for action. This was designed to help lab professionals, administrators, HR groups, or professional societies to use this document to address workforce issues. If you haven't read it, you can go to the link and check it out. There's a lot of great information in there. So from that study, there were three areas identified. These three areas contain aspects that were felt to need to be improved to impact the workforce shortage. So the first was to improve the visibility of the clinical laboratory occupations. The second was improving workforce recruitment and intention. And the third was to focus more on diversity and inclusion in the laboratory. So to raise visibility of the professions, we continue to enhance the materials on the ASCP career web pages, and those are called What's My Next? So last year we posted a one-page roadmap describing all of the laboratory professions, and you can see it there on the left-hand side of the screen. And we also created some videos of laboratory professionals talking about their personal experiences in the laboratory career. This year, we're continuing to build out those What's My Next pages. If you scroll through the What's My Next pages, you'll find some links over here on the right-hand side. There's this box that says Explore Careers, Find a School, Talk to a Career Ambassador, and then FAQs. So if you click on the Explore Careers magnifying glass, this leads you to a page that lists the specific jobs of different laboratory professionals. And each of those is a clickable link to a one-page description of the profession described in simple terms. So like, what's the typical day like? What skills are needed? What's the salary, and the educational requirements for that particular job. And you can see on the right-hand side there, the medical laboratory technician example is shown. So lots of great information at What's My Next available for laboratory professionals to use, or people who want to explore these careers to learn more. So also in support of our goal to raise visibility of the professions, the ASCP and COLA exhibited at the American School Counselors Association meeting in Kansas City in July. And on this slide, we can see a picture there of our own ASCP's own Edna Garcia, along with Jamie Schumacher from COLA. They're in the booth in the front of example lab drawers. You can find the lab drawer at the ASCP website. This is a box that contains the materials to perform either a hematology or a microbiology experiment for a classroom or group. We also had career ambassadors attend the meeting, and there in the middle, you can see Dana Baker describing more about the profession, and she was there to also demonstrate lab tests. Sean Tucker was the other career ambassador that participated. You know, in our experience, it seems that having a little test to demonstrate seems to create a little bit more of a draw to the booth, so then the people at the booth can engage the attendees in conversation and provide the career roadmap. At this meeting, there was also a simple survey that was conducted with 132 visitors who came to the booth. 2/3 of them said that they had heard about laboratory careers, but 80% of them said that they had no materials in their schools to teach students about the laboratory professions. And all of them said that they wanted more information, including visits from career ambassadors to their schools. So we have some great contact information and plenty of work to do visiting those schools to teach them about the laboratory professions. Lots of opportunity there. NACADA is the global community for academic advising for higher education. So this is colleges and universities. ASCP will be exhibiting at their meeting in Pittsburgh in October, and the Workforce Steering Committee is preparing materials for that event as well. The ASCP BOC is reaching out to the National Consortium for Health Science Education to perhaps exhibit at their meeting in the fall. This is a nonprofit education organization that partners with publishers, professional associations, certification providers like the BOC, and the Health Science Educators Association. They promote best practices and career success for the next generation of health professionals, and they're really positioned as the national authority for health science education. The third group shown on this slide is the National Science Teaching Association, and ASCP has recently made contact with this group, and we're trying to determine how to engage either at a meeting or some other venue. So as a result of the engagement at ASCA in 2023, Edna Garcia learned more about online career platforms and tools. These are tools that are used by students from elementary school through high school, and they use them to find areas of aptitude and interest and potentially careers. What was eye-opening to us last year was that some of these websites not only don't have information about lab careers, but sometimes the information they had was incorrect. We also recently had a conversation with Dawn Taylor with JVHL in Michigan, and she made us more aware of one of those career platforms called Zello. And it turns out to be one of the most popular online platforms used in schools, and they were a big sponsor of the ASCA meeting this year as well. And they had information on pathology and pathology assistant, but they had MLT and MLS combined, like the Bureau of Labor Statistics, and they didn't include other laboratory careers. So Edna has been working with them to provide materials from the What's My Next web pages to help them improve the information on their platform with respect to the lab professions. And then they're also going to allow ASCP to review their web pages for accuracy. This year, Edna said that there were 16 online career platform companies at ASCA, so a lot of opportunity for us within this area. So one of the things that we talk about in terms of visibility is the poor visibility of the laboratory professions. And I think this can be exacerbated by the complex and non-standardized job titles and educational program names. The ASCP Board of Certification and volunteers from ASCLS have been working really hard to promote a standardized nomenclature for laboratory professionals, particularly for MLS and for cytologists. Using a single name that's consistent from degree to certification to job title is really the basic goal. And standardizing names for programs and degrees in educational setting is really the first step in the process. So over the last 2 years, some of you may be aware that Dr. Rodney Rohde has been going through the process at Texas State University to change his program's name and degree title from clinical laboratory science to medical laboratory science. So the graphic shown on this slide represents the basic steps in that process. And based on his experience, we're currently preparing a summary guide for other program directors who wish to change their program name and degree name. So lots of thanks goes out to Dr. Rohde for going through this process and documenting what the steps were. Really great progress has been made in this area. I was counting last night only about 20% of programs are not medical laboratory science, and half of those are in New York and California, where licensure laws may make changing a program name a bit more challenging. So great progress in this area so far as well. The Grow Your Own Laboratory is a webinar series that highlights examples of innovative strategies, being used in local laboratories to mitigate the workforce shortage. There have been 3 webinars produced over the last year, and they're all recorded for viewing on the ASC website. Some of the highlights from this series include Dr. John Gensen describing a grant that ARUP labs obtained to build a laboratory training center on their campus, a summer internship program that's been developed by John Bacci at Children's in Boston, some new strategies to recruit, train, and retain phlebotomists in inner city Philadelphia with a government grant there, and in the more rural area of northeastern Pennsylvania at Geisinger. Career ladders are described, and then one of the sessions was focused on bringing NACLS accredited MLS and PA programs to underserved areas. So would like to continue this series in 2024 and 2025 because it's been pretty popular. So if you're listening and you know of a novel program or a new approach to recruitment and retention, particularly in underserved areas, would really like to hear about it and feature you. So please reach out to either myself or Edna Garcia with those ideas. Through the cooperative agreement between ASCP and CDC's OneLab program, CDC is building a training module in the virtual reality space. These include a biosafety cabinet use module and also an open 50,000 square foot lab space with custom built lab equipment in it for virtual exploration. So the virtual reality demos and information will be available at the Workforce Lounge at the annual meeting in Chicago. So hopefully some people will visit and experience the world of virtual reality. Another product of the cooperative agreement with the CDC that was created in response actually to requests from ASCP members at the annual meeting 2 years ago is the Negotiation and Advocacy Toolbox. This toolbox is now complete with best practice information categorized into 5 central pillars, and these can be used to demonstrate your lab's value to the administrators within your own healthcare system. The Amazing Race debuted at Knowledge Lab in 2024, and this will be rerun in Chicago at the annual meeting. It's an interactive educational session highlighting tools in the toolbox that can be used to solve laboratory advocacy scenarios. So sounds like a lot of fun. Hopefully some folks will check out the Amazing Race in Chicago. The Workforce Steering Committee and ASCP staff are also working with the CDC to create basic skills training practice modules to assist labs with on-the-job training for new hires. modules will be coming out soon and include e-learning didactic sessions on things like laboratory safety, routine procedures, lab math and terminology, basic operations of equipment, quality control, and then we'll also include a two-part video series on pipetting. The anticipated launch for that is the fall of 2024. The ASCP will have the privilege of awarding Dr. Alvin Ring Empowerment Scholarships this year for students from underrepresented groups or underserved areas who want to start into the lab profession or advance within the laboratory science careers if they're already in early stages of a career. So a wide range of individuals really are eligible for these grants. They're, anywhere from high school seniors to those who are already working in the laboratory. The scholarships are aimed at providing students with a NAACLS accredited education as a medical lab assistant, phlebotomist, MLT, MLS, or a histotechnologist. ASCP is currently reviewing the applications of 76 individuals who met eligibility criteria. Our wish really would have been that more high school students would have known about the scholarship and applied. This kind of underscores the issues we have with visibility in our secondary schools and, reaching these individuals and getting them into the profession. So with that in mind, an ASCP summer intern, Alice Mumm, is focusing on identifying strategies and resources to more effectively promote lab careers and financial aid opportunities to high school students. So this slide shows some ideas and recommendations for reaching high school students that Alice has identified. So perhaps engaging with people on social media to target the younger generation, for example, with example STEM influencers on Instagram and TikTok. Listening surveys might be conducted. These are a data gathering approach that allows you to build queries to track social media conversations around key topics to gain insight into what topics are engaging to young people. We might have the capacity to do this, or we do have the capacity to do this through social media management platform that ASCP applies called Sprout Social. Alice is also developing a database of underserved schools and social groups. So, from there we can engage them through hubs or meeting areas. And also under consideration would be the ASCP has a DEI group, and some of their events are a possibility for reaching high school students as well. So finally, I'd like to mention the Medical and Public Health Laboratory Workforce Coalition. This group continues to be strong and meet periodically throughout the year. They have been working on some advocacy efforts to Congress, although, right now there's not a whole lot going on in that area because of the elections. But recent meetings have featured a talk from Mike Barron on alternative approaches to lab staffing, and also the work of the COLA Workforce Action Alliance Summit and the progress that this group has made. There are some really great materials that are on the coalition website. That website is listed at the bottom there. It's separate from the ASCP website. This has been an amazing group effort. They've really gathered a lot of people who are very concerned about workforce to address some of these issues. So check out the resources on the coalition website. And finally, just so many acknowledgements, particularly the ASCP Institute for Science, Technology, and Policy in Washington, D.C., and Edna and Iman, Jeff Jacobs, Matt, and Debbie all work very closely on workforce issues. Of course, the entire Workforce Steering Committee for their ideas and their work. Just an amazing group of concerned individuals working closely with the BOC Nomenclature Task Force. We especially appreciate Susan Johnson, Linda Smith, Kathy Doig, Amy, Spitzka and Robin with the BOC. And then, of course, ASCP Marketing and Creative. We can't put the things on the website and make interesting materials without this group. So thanks again for the opportunity to speak today, and I'll turn it back to you.
Thank you very much, Susan, and thank you for your presentation. Uh, I was particularly struck as you spoke about all the opportunities and really calls for us to interact with other people, with students, to engage their interest, and not just interact with them face to face, but in ways that they themselves seek information like social media. I'm grateful too that the ASCP has partnered with the Centers for Disease Control to develop that negotiations toolbox so that we can advocate for ourselves with hospital leadership. All these interactions, they can be awkward or intimidating, particularly with leadership, but they can also be inspiring, both to the students that we would talk with and to the response that the students give to us. So thank you. I'm glad you're the chair and will continue to be the chair of the ASCP Workforce Steering Committee. Our next speaker is Dr. Bianca Frogner. Dr. Bianca wears many hats. She's a health economist, professor in the Department of Family Medicine in the School of Medicine at the University of Washington. And she's also director of the University of Washington Center for Health Workforce Studies, which is the CHWS. This workforce studies group conducts a number of state and national studies with external funding, investigating supply and demand challenges across a wide range of health professionals in multiple health settings. Dr. Frogner and her team there at CHWS have collaborated with the ASCP over the last few years to identify the barriers and facilitators in building a strong clinical laboratory workforce. And they've done so with funding from the Health Resources and Services Administration and Healthineers Fund of the Siemens Foundation. Dr. Frogner, please share your insights with us.
Thank you so much for having me here today. This is exciting to be able to share some brief highlights from a study that we have been doing in collaboration with ASCP, where we're looking at career pathways of the medical lab workforce. And thank you for that introduction, Dr. Davis, about me and the Center for Health Workforce Studies. And with that, I do want to acknowledge the team of individuals at University of Washington who contributed to this study that I'm going to share today, which includes Sue Skillman, the Senior Deputy Director of the Center for Health Workforce Studies, Grace Gunther and Shahida Sharir, who are both research scientists with the center. Also, we have been very fortunate to work for now actually a few years with ASCP's Edna Garcia and Aman Kundu. So we're really excited to have their input and contributions to the work that we're talking about today. Excuse me, and as Dr. Davis mentioned, some of our work has been funded through the Health Resources and Services Administration, and specifically the study that I will be presenting today has been funded through a grant from HRSA. But of course, the content of the material presented here is not representing the official views of or an endorsement of HRSA and its related agencies, and I have no other financial relationships to disclose. So as a brief background, just as to why we have been focused on doing this study and why HRSA had us focus on examining the medical lab workforce, is that COVID certainly pushed the medical lab workforce into the spotlight, with it being front and center in terms of providing information through tests and diagnostic tests to figure out where and how far COVID is spreading in our country and beyond. The Bureau of Labor Statistics estimates that about a little less than 500,000 people are part of this workforce, and that includes medical lab scientists, medical lab technicians, as well as phlebotomists. But at the same time, we do know that there's some challenges with actually tracking who's part of this workforce, given that there are many different occupations that the Bureau of Labor Statistics does not capture. And so there's some limited view in terms of what federal surveys and other data collection efforts across the country are doing to really capture what's happening to this workforce. And over the next 10 years, the Bureau of Labor Statistics is projecting fast growth for the clinical or the medical lab workforce, at least compared to national trends, where over the next 10 years, the workforce is expected to grow at a little under 5% compared to the national projections of all workers being at 2.8%. But we know that there are challenges to meet some of these goals to grow the workforce. As Dr. Harrington discussed earlier, we have done some work together with ASCP to understand some of the challenges, but we know that there is a need for more training programs. I know recently there was a program at University of Maryland that closed. There are shortages of qualified personnel that have been reported across different employment settings. There are increased demands on the workers who are already working currently, as well as the fact that employers themselves are saying that they cannot find the workers that they need. And as Dr. Harrington pointed out, we did a study at University of Washington along with ASCP to better understand the challenges to meet the current needs of the workforce as well as the future needs of the clinical lab workforce. And this all translated to a blueprint for action, which Dr. Harrington did a really nice job explaining some of the great ways in which ASCP is carrying out those actions. Among the things that came out in the report is this recognition that we need to better understand how people get into these professions and what their careers are like once they're in these professions. And that really leads us to what the study is that we did at University of Washington, which is to understand the career pathways of those in the clinical lab workforce. And so we asked some high-level questions to get us into this work, such as understanding what were the career pathways of people who are in current clinical lab jobs. So what other jobs did they do before they got into their current jobs? What were the facilitators that got them to these jobs, as well as what are the barriers? And we also asked what were some of the future plans of people who were in clinical lab jobs to figure out what barriers there might be to allowing them to pursue a long-term career in these jobs. So together with ASCP's Workforce Committee, as well as Edna and Aman, we developed a survey instrument where we covered a number of domains, understanding some basic socio-demographic factors, identifying some pre-laboratory career factors, identifying prior lab work benefits and challenges, as well as their what their current work characteristics look like, and what some benefits and challenges were of those current work characteristics, as well as what the career outlook might be into the future. We surveyed people across a couple months in 2023, so a little over a year ago now, and we sampled a number of occupations: medical lab scientists, medical lab technicians, histotechnologists, histotechnicians, cytologists, and phlebotomists. In the end, we worked with ASCP to recruit these workers, and as kind of given just who ASCP is most connected with, we had a good number of medical lab scientists respond to our survey. We also had a good number of medical lab technicians. We had smaller numbers of respondents from some of the other occupational categories. But nonetheless, we looked at all of these different occupations, and we're still finalizing our analysis at this point in time. So I'm going to share with you some of the findings that are focused on the MLSs and the MLTs. And in total, we had about 1,100 respondents. 881 are those who identified as currently employed medical lab scientists, or they retired as MLSs. So that was their last job. Relatedly, we had 175 MLTs who were either currently employed or retired. We had probably on the order of about 50 or so of each of the other occupations. So I'm going to again turn to some of the findings from the MLSs and MLTs. We have many findings from this survey. So we are trying to get the work published so that you can see all of the results from all the different occupations. But here I'm going to just highlight a few key findings for you all today. So briefly, just to give you a sense of who responded to our survey, out of the MLSs as well as our MLTs, the workforce that responded to the survey are predominantly female. A little over 80% of both the MLSs and MLTs identified as being female. The MLSs who responded were slightly older than the MLT population. Predominantly, both workforces are of white or European descent. The MLTs seem to be a little bit more diverse than the MLSs. Both have about similar percentages of respondents who were born in the US or US territories. Disability does show up as a condition that people have, either that it's disabilities that they could either be working with or managing while working. We had higher levels of disability reported among our MLTs and our MLSs. And not surprisingly, the degrees are such that most of the MLSs who responded had a bachelor's degree or higher, while MLTs had an associate's degree or higher. Now, to some of the fun results here. So there's certainly been a lot of discussion about how people find their way into these medical lab jobs. And what we are finding is that there are some similarities in terms of how MLSs and MLTs found their way into their careers. And the top two most common ways people found their way into these careers were through family, friends, and coworkers, as well as those college counselors, advisors, or career centers. So it really speaks to the need to connect to those career counselors that Dr. Harrington talked about earlier. So the people could check more than one box here. So people probably found their way to these professions through a multiple number of mechanisms. But again, it's worth noting that friends and families were really at the top of that list for both occupations. In terms of how people finance their way through their education, there have been some changes over time. We used a cutoff period of the year 2000 to capture folks who might have been in the field for a while versus those who might be relatively new to the field, to understand how people have been financing their way through their education. Self-finance has been one of the most common ways in which people are supporting themselves through their educational process. And again, people can check off multiple boxes here. The number who are reporting that they self-finance their way through school has been declining over time. And what MLSs are relying on more is the federally assisted student loan programs out there to help finance their way through school. MLTs, where we're seeing some growth that is exciting and worth exploring more, are those saying that they're seeing more paid apprenticeships and internships as a way to finance their transition into an MLT position. So I'm not going to be able to show this graph side by side by MLS and MLTs, but I'll show MLSs and MLTs one after another here in these slides. So we asked a number of questions about how they felt about various statements about their current job to get a sense of their level of career satisfaction. And in blue, you see responses that suggest that they strongly agree or agree with the following statements, while yellow and red would suggest that they strongly disagree or disagree with the various statements. And in general, people seem to feel that they're very happy with their jobs. They feel that they're working in a safe environment. They feel like that they can get the work schedule that they want and that they're getting good pay and benefits. Where the MLSs reported more levels of disagreement or strongly disagreeing with some statements was around feeling that that they had strong management or leadership at their workplace, or that their workplace was adequately staffed. We saw similar trends for MLTs. And again, we had slightly higher percentages of MLTs who reported that they disagreed with the statement that their current job has strong management or leadership and that their workplace was adequately staffed. Continuing on with more questions about job satisfaction and career outlook. Again, for MLSs, there's a high percentage of individuals who agreed with the statement that they enjoyed their work and that they felt valued by their colleagues. Where there was less agreement with various statements was around the sense that they felt respected in the field of pathology or that they felt appreciated by their institution. Again, the trends were fairly similar for MLTs, where again, there was a higher percentages of individuals who reported that they did not agree with the statement that they felt appreciated by their institution or respected by the field of pathology. There was also a relatively high percentage of people who also disagreed with the statement that they felt valued by professionals outside of their team. When it comes to why people left their last prior laboratory job, because many folks had another laboratory job than the one that they're in currently, the things that had them that were prioritized as things that were important for why they left their jobs and that there was some kind of job transition was related to better pay and benefits. That was a common response for both of MLSs and MLTs. For MLSs, there was more reporting of wanting to look for career advancement or promotion opportunities. For medical lab technicians, there was poor management and leadership as being one of the top drivers for why they left their prior laboratory career. So these are just snippets of, again, many results that we have from our surveys, but these are some of the ones that really stuck out to us about, and we think it's really important for us to really understand the role of family and friends and other coworkers and acquaintances in terms of influencing people's interests into clinical lab careers. Also, though, college counselors and advisors and career centers play an important role. It is worth noting that while many people are self-financing their way through these programs to become MLSs and MLTs, student loans are quite common, and apprenticeships. So again, those are on-the-job training opportunities where people get paid while they're also getting educated to become an MLT. Overall, people are very satisfied with their work, which is fantastic to hear. And I think that we have heard many times anecdotally to be the case. However, there are areas for improvement around leadership and management, making sure that the different work environments are staffed adequately, and that people feel that they are recognized by not only the field, but by their institution and other health professions. And also, in addition to pay is certainly important in terms of why people move and change jobs, and that's common across many occupations. But the thing that is worth spending some time thinking about too are ways in which we can help improve career advancement opportunities for our clinical lab professions, and also and think about ways to promote people within their work environment. So we are hoping that we'll have this work published soon so that you can all read and dive into the findings for some of our other clinical lab workers that we surveyed. And we're really excited to be able to share some of these findings today. So thank you so much for this opportunity.
And thank you, Dr. Frogner. I appreciate your presentation. Actually, as I did with Dr. Harrington, I'm going to take the liberty of using your first name, Bianca. And I do that for a specific reason. I myself don't think of me as Dr. Davis. I think of me as Greg. And I find it easier to work side by side with other people when we can roll up our sleeves together on a first name basis. But the work that you've done, the information that you presented encourages me. And I was glad to hear that the Bureau of Labor Statistics predicts growth for our profession I hope that we will be able to further affect that growth by engaging and trying to capture the interest of young people in the sort of work that we have chosen to do ourselves. Thank you. Our next and final speaker is Amy Spitzka. You probably know her. She currently serves as the Executive Director for the ASCP Board of Certification, or the BOC. She is a patient-centric advocate for the laboratory professional workforce. Ms. Spixka's leadership elevates the ASCP BOC's portfolio of 26 credentials provided globally in 130 countries, spanning the entire laboratory medicine and pathology healthcare continuum. Amy's clinical practice, her education, and published research areas of interest and awards center on patient safety, continuous quality improvement, laboratory innovation, and advancing professional development opportunities for laboratory professionals and students. So please, Amy, tell us more of your perspective these days for the Board of Certification.
Thank you, Dr. Davis, for that very warm introduction. I'll be sharing the value of the Board of Certification credentialing today, focusing primarily on engagement priorities and operations excellence. I also want to regard Drs. Harrington and Frogner for their excellent leadership, not only on behalf of what they're doing for advocacy and also deep research, but just to engage with our entire workforce. I have no financial relationships with ineligible companies to disclose. I am excited to share the value of the BOC with you today. And as our North Star, we are a mission and vision driven organization. As you can see in the lower right-hand corner, our mission is to provide excellence in certification and in full credentialing of laboratory professionals on behalf of the patients that we serve worldwide. You yourself may know the Board of Certification because you're either studying for one of our exams, whether it be the first or the fifth, or you bear one of our credentials. I'm excited to share with you current and future state of the BOC today, and I just want to encourage you that if at any point there's an opportunity for us to work with you to even more evidence the value of the BOC, we are here as your partner. The BOC in just 4 years will celebrate its 100th anniversary. And as relates to that, we see that as evidence of value. We also know that we have the highest standards. We are ANAB accredited with ISO 17024 standards. And with that, we know that we are the employer preferred credentialing agency for laboratory professionals. Let's get into more of our value. I would love to start with our Board of Governors. To be true, many of our credential holders and stakeholders are unaware of the strength of our Board of Governors, and so this is certainly a value proposition we're excited to share with you today. Our sponsoring, participating, and collaborating societies are all shown in this image, and what you can see is that we span the entire spectrum of laboratory medicine and pathology. So around the Board of Governors table, we hear from representation from all of these partners. They not only help us guide deep research and innovation, but also certainly keep us apprised of where we need to be with advancing our value. We appreciate them for advocacy. We appreciate them for the opportunity to reach out to the current and next generations of laboratory professionals in very tailored and meaningful ways. So we're hopeful that you're excited as well regarding our Board of Governors and the 35 committees and task forces that serve as part of the Board of Governors. I'll touch on some of those key committees and task forces today. Moving on, we also recognize that value is associated with volume. What I'm sharing with you here are the ASCP BOC credentials that have been attained both domestically and around the world, and our credential holder volumes. It's really the people that we're most excited about. As you can see on the left-hand side, however, the total credentials attained usurp 635,000, growing every day. And you can find certainly the credentials you have or you're seeking to have in the numbers that are shown below, which are cumulative up through about mid-July. In addition, again, as I shared, it's the credential holders that are the sure value for us. Nearly 590,000 credential holders, as you can see, that bear our credentials. They've attained these through their diligence and also working with us as the elevated highest standard. And to be fair, all of these credentials represent the fact that there are about 9.7% of our credential holders that have 2 or more, what we refer to as multi or stacked credentials. This is incredibly important. You have come to know the BOC as providing publicly available data every year. We are just on the precipice of offering even more data to you as program directors, students, graduates, practitioners, and we hope that you will stay with us to learn even more about our stacked credential holders. Our volumes continue to grow, as you can see with this 10-year snapshot, that 2023 was our strongest year in that span of time. Certainly the impact of COVID was real to all of us, and we have rebounded very positively. And we hope that you in your career or you in your leadership of laboratory professionals have really benefited from the service that we've provided. As shared by Dr. Harrington and Dr. Frogner, the research that has been done on behalf of laboratory professionals is incredibly meaningful. There are 4 key components that we all agree that we need to contribute to. And this is, I would say, not only just puzzle pieces coming together in very meaningful ways, but all of us looking at ways in which we can first identify, promote, and report engagement strategies. Please stay with the Board of Certification. Follow us on social media. We are about to launch a new website in the new year in which we will not only continue to elevate laboratory professionals, but even at the individual level, promote value vignettes as well as organizations that are engaging with us and are seeing really strong evidence as to what this means for their practitioners and patients. I'll give examples of that yet today in my presentation. In addition, this is our opportunity to unify and foster well-being. Edna, Aman, others who have been mentioned today certainly are recognized with the Wage and Vacancy Survey. On behalf of program directors and students, the BOC does the same. And again, the recognized talent of stakeholders. If you or your organization has a value vignette that involves the Board of Certification, we'd love to hear from you. And we also want to share, as I will later today, some ways that we have assured well-being by making sure that we in and of ourselves in this 3rd cohort address barriers, improve our own processes, and develop tools to benefit not only those that are going to join our workforce, but that we're honored to have retained in our workforce. And so I'll share not only operational improvements that we've made, but also tools that we have deployed in support of that. And last but certainly not least, when we look at best practices, part of the reason we're here today is to share all that we want to do and all that we have done for enhanced engagement and professional development. I will offer just quickly that on behalf of the Board of Certification, our professional development portfolio is certainly focused on our credential maintenance program. Again, enhancing individuals' knowledge, their skills as they progress across their entire career. Dr. Harrington made mention of the Medical and Public Health Laboratory Workforce Coalition, comprised of 30 organizations plus more, I believe, current date, that have the opportunity to engage with others. Having a voice in this space can grow as part of a coalition. And so the Workforce Coalition that we are a part of, the Board of Certification, others, as shared previously, have now joined tomorrow's Workforce Coalition, touching almost 800 organizations collectively working to improve workforce development opportunities. So just as I had shared before, it's all of us working together in very meaningful ways where we can amplify our contributions and also say, here's an area that we can very much tailor and focus on. But this one in particular is one of collaboration. While it has slowed a little bit, just given everything that's happening in the political environment, we have been able to assure that 120 members of Congress will co-sponsor this tomorrow's Workforce Act. And to be fair to this, what it does is really shift the 529 paradigm from a college savings plan to a career savings plan to meet people where they're at as they pursue career growth, upward career trajectory, whether they're mid-career or they're diverging from a typical academic route. And this helps people join us in the laboratory for post-secondary training, and these expenses would also include credentialing. So we're very happy to contribute and deliver on this. When I mentioned our Board of Governors and the 35 committees, over 175 SMEs who contribute day in and day out to the Board of Certification value. One of our recognized committees is Research and Development. They have had some recent Sentinel publications, as you can see here, really focusing on the impact of COVID, not only for program directors, but also our graduates. Those graduates who are practitioners, our colleagues today and tomorrow. So I encourage you to learn more about the BOC and the value that we offer through research and development, other committees, to give you, again, a voice and recognition within your organizations, but also to have, as you can see here, insights as to how to move beyond the impact of COVID and really engage in meaningful ways. In addition, one of our task forces is the Nomenclature Task Force. We have had the opportunity to promote not only MLS or medical laboratory scientists to really elevate that cohort, but also to accurately recognize cytologists. And so we're always looking for ways to unify the visibility of scientists through that accurate nomenclature. And this is certainly a journey, as you know, and we are making steps day by day. One of the recent advances we've had is for medical laboratory job titles and descriptions. This is a downloadable guide that will help you, your hiring managers, HR, and other partners make sure that you have a template to start with when it comes to medical laboratory technician or MLT duties and responsibilities, as well as those for MLS. So we're excited to provide tools, resources at any opportunity as we can support you. We also know that laboratory medicine and pathology are ever advancing, so too is the BOC. And with that, we do have new and emerging credentials. The Doctorate of Clinical Laboratory Sciences, these new practitioners who were recently recognized in the CLIA personnel regulations, will have an examination through the Board of Certification. For quite a while, we had a work group that was very much looking at, the advancement of DCLS, how they're contributing to patients, what their roles and responsibilities are. We are now transitioning to an examination committee towards offering a BOC credential for these partners as well. We're very excited to be able to do this. In addition, you may be interested in promoting a new credential. You may see in your practice model in your region that there are some opportunities by which a new credential through the BOC could be beneficial to the workforce. We're always willing to listen, and very much open to new opportunities for credentials. And so please reach out to us. Again, with our new website, we'll have opportunities for you to have connectivity to our revised policy, procedure, and form for the new credential proposal. Previously, I had made mention of some outstanding operations optimizations that we had made on behalf of the workforce. This number, 13,269, has now been surpassed even as of today. And what this represents are the number of laboratory professionals who have graduated through either Route 1 or Route 2 for molecular biology. So all of these soon-to-be new practitioners bearing our credentials have had the opportunity through a new operations approach referred to as auto eligibility. Historically, when an individual would apply and pay for one of our examinations, they would wait several weeks in an effort to hear our response that they could go ahead and apply for the date, time, and location of their examination preference. We are now able to offer this to these individuals in 48 hours. And so how this works is, once again, as a person applies, pays, their program director within moments, as we understand it and as we've programmed this operational excellence, is that the program director can sign off on the electronic eligibility verification, which immediately lets that applicant move forward and apply again for the date, time, and location of their preference. This is the BOC's contribution to the workforce given the crisis. So we effectively have now ensured that newly credentialed laboratory professionals can more effectively contribute to patient care. They can be at their microscope, their microtome, their bench, whatever that might be, to be part of the high quality workforce. And we're so happy to deliver on this. We also want to be fair to the fact that we continue to monitor and nurture emerging markets. We certainly recognize that our ASCPI volumes, just like our total overall volumes, are growing. And in that space of growth, we have recognized that our MLS ASCPI volumes have now surpassed the domestic MLS volumes. And so as we again engage both here and across the globe, this is our opportunity to really make sure that we have meaningful connections and we're meeting our stakeholders where they're at. We also want to share with you that we continue to work in the space of licensure, even with our territory. So Puerto Rico most recently signed into their law both the histotechnician and histotechnologist examinations by the BOC to be part of the Puerto Rico licensure. Very exciting. On this slide and the one to follow, these are ones for you to skim through as I'm speaking, and just want for you to share that the BOC is looking to have a presence in very meaningful and evident ways. And over the course of the last 18 months, we have published nearly 30 publications and also shared presentations in that space. You'll see us in places that you would expect us to be, but you'll also see us in new and emerging opportunities, such as quality and safety forums on the international front when it comes to healthcare. And so whether it's your organization, your society, you as an individual, if there's ever an opportunity to share our data, to research together, and again, present and publish in very meaningful ways, we are here to do so. As I finalize my presentation, I also want for you to know that we have resources available to you, such as the BOC value statement. If there's ever an opportunity you need to promote credentialing, whether it's to the C-suite, hiring managers, or potentially even a dean of your program as relates to our credentialing value. I also share with you here two screenshots as relates to advancing medical laboratory careers through Vanderbilt University, and then the Mayo Clinic's Allied Health Scholarship Program. These are not examples of exclusion. If you follow us again on social media or newsletter or beyond, you'll see that many organizations are reaching out to us and sharing examples, for one of which Vanderbilt, in which their upward career trajectory is aligned with the Board of Certification credentialing schema. So as people get promoted and again climb that trajectory, there's good alignment there. We also recognize Mayo Clinic, who has worked closely with our phlebotomists, those leaders at the bedside, Again, we span the spectrum from phlebotomists all the way through high complexity laboratory directors. And in this example, Mayo has taken the opportunity to really nurture their phlebotomists and make sure that they have scholarships to help with their program and training requirements. So as I close, I hope that this has, not only solidified what you've come to expect as very high value from the Board of Certification, but also given you new insights as to how we remain patient-centric and very much data-driven. We are here at any time, and certainly as I close, I welcome questions even to my inbox. And so please feel free to reach out. And in addition, I want to thank all who made this possible, which includes our Board of Governors, our amazing Board of Certification team, and all of our outstanding volunteers. So with that, I thank you, and I look forward to hearing from you soon.
Thank you very much for that presentation, Amy. And thank all of you, Amy, Susan, Bianca, for your presentations. I would actually like to share an anecdote that I have, and it goes back to the call for us to interact with other people. I hope that all of you will take this as a personal challenge to roll your sleeves up and get involved in this very important activity. I've done it myself. In July of this year, I was one of about a half a dozen forensic pathologists who met with high school and college students. It was actually a virtual meeting with people from all over the country getting together. The students were very interested in what we had to say. Many of them expressed later, we heard, that they had no idea that this was something that they could actually do or aspire to. They thought it was somehow not realistic for them, but it is realistic. And you can help change people. We saw the information that Bianca presented of that family and friends and or workers in the field that a person knows or grew up with are the primary influence on why someone would choose laboratory medicine practice as a profession. So please make yourself a part of that group of individuals trying to bring up the next generation and investing not only in the future of our profession, but in the future of healthcare and of good patient care. Those of you who have seen this now, you've finished watching the video. I thank you for seeking and listening to this presentation. This is a preliminary presentation anticipating the 2024 ASCP annual meeting. I hope to see you there at the meeting proper. And thank you very much for your interest and for caring. This is Greg Davis. Bye.